to America's Forum. Miranda Khan right there, J.D. Hayworth right here, and via satellite, joining us now to talk about Ebola, Dr. Peter Hotez, the chair of tropical pediatrics at the Texas Children's Hospital. There he is, resplendent in what is mandatory neckwear for pediatricians, a bow tie. And that may be a note of whimsy in stark contrast to the serious topic of Ebola. Doctor, we thank you very much for your time and appreciate you joining us here on America's Forum.
Thanks for having me.
Doc, this whole Ebola question, we're hearing estimates that pretty soon there are going to be 20,000 patients.
Right.
There in Africa. We worry about it spreading. Has this invoked global panic that perhaps is unjustified?
Well, I think there's good news and bad news. The good news is I'm fairly confident that we will not see an expansion of Ebola beyond the 4 affected West African countries, and mostly in Liberia and Sierra Leone. The bad news is that what we're seeing is still that we're not containing the epidemic in Liberia and Sierra Leone. One of the reasons why the World Health Organization, the WHO, made the announcement this morning is that 40% of all of the cases of Ebola in this current West African outbreak have occurred over the last 3 weeks. So it's clear that when it comes to Ebola in West Africa, it cannot be business as usual.
Well, earlier you heard Dr. J.D. mention that patient that was flown back to America, not showing any symptoms of being infected with Ebola, but as we know, it can take several weeks before the symptoms actually present themselves. So is that kind of, and some people would say that's too risky, that's a risk that's too high to take.
Well, you know, the Ebola virus is not all that easily transmissible. It's not like influenza or measles, which is as highly contagious. The reason that we're seeing this devastating epidemic in West Africa is this is occurring among countries that are just emerging out of decades of civil war. They've had a total breakdown in their healthcare infrastructure. It's been difficult, near impossible, to implement infection control practices on their own, and this is why the WHO now has this new response, which, by the way, now comes with a price tag. The WHO has put into their document this morning that they're going to require about $489 million, almost $500 million in new assistance in order to get this under control over the next 6 to 9 months.
But doctor, some people are alarmed. Everyone keeps saying it's very difficult for this to spread, yet you just mentioned there are some estimates of 20,000 cases, more than 6 times as many as doctors know about now. We've had doctors that are trained to not get infected that are getting the disease. So a lot of people are concerned. Are those not valid reasons for people to be concerned?
Well, I've kind of flipped that around a little bit and tell people something that's quite surprising, which is that we're about to report in a week or two that we estimate that right now in the United States we already have an estimated 12 million Americans living with one or more neglected tropical disease. And so we already have widespread tropical diseases in Texas and the Gulf Coast. The likelihood of Ebola coming to the U.S. is extremely remote, and we need to start paying some attention to the diseases that are already here and already widespread, particularly among the poor living in some of the poorest parts of the American South.
And Dr. Hotez, as we talk about this, about 1.5 minutes remains. We need to really shift our focus to our southern border, the influx of the juveniles coming across apparently from Central America. We are hearing widespread infectious diseases coming into the United States. Putting on your public health hat for a second, not getting into cases breaking confidentiality, tell us about the nature of the threat of these diseases coming into the United States.
Well, so I actually think the threat of diseases coming into the United States from Central America is fairly remote.
Really?
So the problem is not so much immigration. The problem is, you know, we call them neglected tropical diseases. It's a bit of a misnomer. They're diseases of poverty. And the astonishing fact is that we have 20 million Americans, mostly living in the South, who live in what's called extreme poverty, at 1/2 the U.S. poverty level, and now almost 2 million families living on less than $2 a day. And so, for instance, we can drive into the 5th Ward of Houston, Texas, not far away from very opulent communities, and see environmental degradation, poor quality housing, no window screens, discarded tires along the side of the road, collecting water. It looks like the global health movie you show to a first-year medical student. So that's where the focus needs to be. It's this where the Texas and the Gulf Coast are at the confluence of poverty
and
and
we've
also
got you.
warm
Unfortunately,
climate,
Dr.
and those two
Hotez,
together are what are fueling this.
time is growing short. We thank you for your time. Look forward to having you back on our program, and America's Forum continues here.